Hi, this is Hank with Amada Senior Care Hoboken, and we have a very special guest with us today, my good friend and college roommate from UCLA, Curtis. Thank you for joining us.
Hey, thanks for
Curtis,
having me.
Curtis has had a lot of experience with caregiving for both his mom and his dad, and he's going to share with us how it went in a two-part series. Today, we're going to talk about his mom, Diane, and how she was cared for later in her life. Thank you, Curtis, for joining us. Can you tell us about your mom?
Yeah, sure. First of all, thanks for having me here. Always happy to talk about the subject because I have a lot of experience here. So my mom was in about her mid 60s, I think around 64 at the time that care started to be a concern for us. And initially, my dad and my mom, who lived together, uh, would do their best to take care of my mom's needs. And so I'll back up a little, give you her condition, which is my mom was wheelchair bound for most of her adult life, probably from about the time I was in, I'd say, high school. And over the years, as she became older, her needs tend to increase year over year. Her physical abilities diminished. And it got to a point with my mom, my dad, that they just unfortunately couldn't do it together. And it was a tremendous burden on my dad. And we at some point made a decision that she was going to need more full-time care.
Right. And so what was that decision-making process like? Did you have discussions with your dad and mom, or was it kind of they made the decision?
No, it wasn't an easy discussion. And I think that's probably the theme of what we'll talk a lot about today is, this is always a very challenging time in a parent's life and a child's life to make decisions collectively that maybe one doesn't feel is the best decision. I think my dad was very opposed initially to allowing someone else to care for his wife. And even though, to be fair to him, he wasn't the best caregiver.
Right.
It wasn't
Right.
really his skill set. And so
Right.
there was a lot of discussion, and it took us some time to finally get to a point of, expressing to him and my mom that there needed to be professional care intervention, essentially.
Right. Did he feel like a sense of guilt that, he wasn't taking care of her on his own?
I don't think he would ever admit it, but yeah, absolutely. And I think even as a child to a parent who needs care, there's a sense of guilt. I personally lived out of state, and my sister was closest, and so there was a tremendous burden on her. So I felt a sense of guilt just for the fact that I couldn't, participate as actively as she could.
Right. And did you have a caregiver at home first, or did she just go from home to facility?
We had someone who helped out a couple days a week, and it was someone who wasn't a professional, to be fair.
Right. Right.
It was someone that we had grown up with over the years who knew my family very well. And I believe she did her best. But when you start talking about, getting someone dressed, when you talk about somebody who needs bathing, when you talk about somebody who
Yep.
needs assistance in the restroom, there's a level of professionalism that you need with that. And I
Yeah.
think
And
that,
training.
and training, and that's something my dad probably threw his back out 12 times trying to assist my mom
Oh,
because
wow.
he didn't know how to help or how to lift. And to be fair, I had to do it myself physically at times when I was in town with them. And it's not easy.
And he's older than your mom or same age?
He's 9 years older than my mom. So my
Right.
dad was in his mid 70s at the time.
Right. Right. That's hard. That's hard. So you mentioned she went into a facility. Just want to make the distinction. Did she go into a skilled nursing facility or an assisted living facility?
She went into skilled nursing.
Okay.
That was uh, what we deemed as we kind of worked through the scenarios, which she'd need the most care,
Right.
and assisted living just wasn't really
Wasn't
possible
enough.
for her. Not,
Right.
based on her needs.
Right. Was there any financial component to this decision-making process?
Tremendous, and we could probably talk for 30 minutes on that by itself, which is care, and this is now probably going back 6, 7 years, is very expensive.
Yep.
And we had to figure out what we believed to be the best facility we could find for her based on the financial restraints that we had. And so that was a difficult decision to make as well, because I think, as maybe we'll get to it, as we went through this journey, what you realize is care, depending on if you're spending $10,000 a month, you're spending $6,000 a month. there isn't a tremendous difference in those in the care that you receive, unfortunately, is what I found.
Right. It may look aesthetically different,
Yeah,
but if you push the button, it might still take 30 minutes to an hour for someone to show up.
absolutely. And consistency of care between individuals.
Right.
You're talking about facilities who have hourly workers, who have new workers,
Right.
and to
Weekends,
establish.
it's a different shift.
Yeah, and depending on who knows the patient well enough to understand their needs at an intimate level, that's a near impossibility based on what
Right.
we experienced.
Right. And were you able to find a facility that was close to where your father lived?
Yeah, we were fortunate. We found something that was probably about 7 miles from where he lived, so it
Oh,
was
that's pretty
reasonable.
close.
Yeah, it was reasonable in terms of his ability to get to see
Okay.
my mom.
That's good. That's good. So overall, what did you think of the quality of the care with your mother?
If you were to ask my sister this question, you might get
A
a
lot of swear
different
words.
answer. Less, yeah, less
We need
four-letter
bleeping,
words.
a lot of
I
bleeping.
think, I think the care was okay. And I'm probably being generous when I say that. I think that, with my mom's condition, who was essentially bedridden, who really didn't have the strength to get herself out of bed, and to, do really anything on her own, and we referenced it earlier, the consistency of the care and the level of care you get is very inconsistent. And it honestly is a day-to-day, week-to-week process where what we learned as we went through this is the importance of someone there to advocate is incredibly important.
Right.
And I would see on countless visits to be with my mom, patients who maybe didn't have an advocate. And, that directly impacts the level of care they're able to get
Absolutely.
because you don't have someone in there, I don't want to say fighting for, but just really making
Mm.
people realize the situation that your loved one is in. And that's a challenge. So, in summary, the care was okay. I think my
Right.
sister has a lot of bad memories of seeing my mom not cared for in a manner that she felt was fair for her.
Right. Anything that you saw was overly positive or overly negative about the
I,
experience with
I
that
would
facility?
always, yeah, I would always say there was the best of intent. I truly believe that, the nurses that we had experiences with always had the best of intent. I think what you find in the care system today is just the ability for people to really understand a patient's needs. And
Right.
they may have a high level understanding of what they need, and they're kind of checking the box, so to speak. It's not for lack of them wanting to. I think it's the number of patients they're having to care for.
Right.
I
Right.
think it's the ability for them to really spend time with patients. And so I think they are trying to rush from patient to patient to do their best. And if you've been to a nursing facility like that, it's a very volatile facility. You have people coming in and out constantly. You have people who've passed. You have patients who are in different levels of care, whether it's dementia or Alzheimer's. And so it's a difficult situation to put a loved one in for sure.
Yeah, yeah, we still see that in all the facilities that I go to, and again, differing levels of care. But
Yeah,
the one thing that's very consistent with the clients that we speak to is that the places are typically understaffed,
yeah,
and so they hit the button and nobody's coming, or it takes them
yeah.
30 minutes, right? And that's very, very consistent.
Yeah. And,
Um,
and depending on the condition of the patient, I will tell you, like, my mom had difficulty swallowing liquids. And there would these sometimes be oh, you can't use a straw or you can use a straw. And something that's such a detailed level of care that it's difficult for these individuals, these nurses or these assistants to help patients like that because they are moving too quickly, unfortunately.
right, right. Um, we talked about the intent of the caregivers and the nurses. Generally speaking, were you satisfied with when they were caring for them or for your mother? How were they treated? Things like that.
Yeah. Again, I continue to believe that some of them did the best they could. I think others were a bit more transactional in their care for my mom, and it wasn't about really getting and trying to understand my mom or her needs. It was, hey, I went in, I checked on the patient, and I left the room.
Right.
We did have a few nurses who we became close with. My mom was in the skilled nursing facility for almost 7 years. So we knew them very well in some cases, but in many cases, a lot of these people had moved on or left the company or the nursing facility we were with. And so it was difficult to have the consistency of care that we'd want for our mom,
Right.
and I
Right.
think that was always the toughest part.
Yeah, I mean that's how I felt, back when my mom was
Yep.
going through her cancer treatment. I felt very much that many of the workers that we worked with were just checking the box to,
Yeah.
okay, well we took her vitals, whatever, and then there'd be this very rare gem who came in just
Yep.
all smiles, full of compassion,
Yeah.
and really tried to put a smile on my mother's face, and that's rare. It's
Yeah.
unfortunately very rare.
I
Um,
think that is the exception and not the rule for
right,
sure.
right. What about the doctors? How are the physicians?
Yeah, my mom was fortunate in the sense that we had the same physician that had been treating her for years. And I think that when treating a patient in my mom's condition, there wasn't a cure. My mom wasn't suddenly going to get up and walk out of this facility.
Right,
And so I think it felt very much like a maintain. Like we're going to check on your mom and we're going to check her major vitals and we're going to do some blood work from occasion to occasion to see how she's doing. But that was really the bulk of it. It was more if something came up, could we treat it? And for someone who is in a bed 24/7, um, there's a lot of complications that come with that. Right?
yep,
There's
yep.
too
Bed
many
sores. Yeah,
bed
we see
sores, yeah, and there's
UTI.
infections,
Yep,
UTIs. We had
yep.
many, many, probably too many visits to ERs because of things like that. And that's where you get into what's the level of care, right? In other words, if somebody's experiencing UTIs countless times, then you question, well, how often are you checking for signs of those things?
Right.
And
How often is
that's
she being changed? Right.
yeah, and that was I don't want to say it was a constant battle, but it was a multi-year battle. And really, what we figured out, and probably oversharing, undersharing, is we ended up putting my mom on supplements ourselves to prevent the UTIs,
Right.
and it
Right.
worked fantastic. But it wasn't a solution a doctor or a nurse or anyone provided. It was we decided that there was probably a different or better path.
Right. Right. So I know your mother's journey at the facility lasted a long time, and you
Yeah.
weren't physically there. You're away in Oregon.
Yeah.
How was that for you emotionally?
It's terrible. I don't know any adult in general who starts to care for a parent that doesn't feel a sense of guilt because ultimately, I didn't have, millions of dollars that I could, build a addition to my house and have her there and see every day. So I think that being away from her was difficult. I definitely felt removed. And, as I mentioned earlier, having my sister there was a tremendous help,
Yep.
but also a tremendous amount of burden, or a burden on her shoulders to have a family, to have a full-time job, and to be able to check in on my mom and
Three kids.
represent on her behalf because my mom and I didn't share this earlier, my mom was pretty close the last 3, 4 years to being nonverbal. She had a very difficult time communicating her needs or her pain level or what was wrong. So, it was kind of the extreme situation that somebody has to face. And I think it was tough for me, obviously, because every time I got to visit my mom, it was wonderful to see her, but, you would also have the realization that she wasn't going to get better.
Right. Right.
Yeah.
And it was a long, you said 7 years at the facility?
7 years in the facility. Yeah. Yeah.
Yep.
It was
Yep.
tough.
Yeah, that is tough. So, do you have any advice for someone going through a similar situation?
Yeah. Listen, I think that best advice I received was from a social worker. And this is probably after her second or third visit to the ER. She had a UTI, uh, went to septic, was on multiple antibiotics. And we happened to be talking to a social worker at the facility or at the hospital, actually. And we were very frustrated with the facility we're at because it was multiple times we'd gone through this. And he was very quick to point out that you may be frustrated, but there's no silver bullet.
Right.
And what he was referencing is she could be at facility A and it's a great facility, and you could put her at facility B, which is 3x the amount of money, and you think you're going to get the best care in the world, and you're actually going to end up in the same situation. And
Right.
this is somebody who sees this every single
Right.
day, every
Right.
single week. And it was a little eye-opening for us of like, wow, you know, having to go through this with my mom and never feeling like we could get her the best care because financial constraints, and the realization of like, even if we had $10,000 extra every month to provide for her, it may not make a difference. And
Right.
so I just think that as you go into a situation like this, one, you're emotionally going to feel a sense of guilt about this. Like no child wants to put his parents in a facility and then have to fight for their you know, be an advocate for them and fight for them every single day. And you know, everybody's situation is a bit different, but I would generally say to even friends I know who've gone through this same situation, I hear very similar stories. It's just a tough situation because in some cases parents are not willing. It's a tough situation because the care that you're getting. I just think that this is a part of, you know, I guess an adult's journey that we go through that is not pleasant. It's, you know, you want to do the best for your parent as possible. And sometimes that doesn't always get you the results that you want.
Right. Right. No, there's no, as you said, there's no silver bullet.
Yeah.
And it's just, you also didn't add in the fact that, there could be disagreement amongst family members about
Yeah.
what the right answer is. Because
Yeah.
that happens a lot too, where people just disagree
Yeah.
about, okay, we're not going to send her a facility. No, that's the best place. And
Yeah.
then you start arguing over finances. So there's a lot that can go into it. And there's only two two of you, right? You and your sister,
Yeah.
but I've seen it where they're like four kids and they're disagreeing on everything. So
Yeah.
it is very difficult. So
Yeah.
any last takeaways from your experience with your mother that you want to share with our audience?
Yeah. I would, you know, I would say this, and then we mentioned it throughout. I think the realization for our family as we went through this is the advocacy you need to have for your parent. And I think that you really do have to make sure that they are getting great care. And it doesn't matter what level of facility you're at, how great, how wonderful, or what you're able to afford. I think you have to realize that you have to go into these situations and know that you're going to have to be um, speaking on behalf of your parent to help them and making sure they're getting the best care they possibly can. Because I've seen situations where when we did fight for a certain amount of care, a certain amount of attention, we could get it. It took a lot of work and it took a lot of effort, but you can get it. I think the other thing too is you just have to realize that, as you mentioned, it's a dynamic and complex situation. When you're putting a family member through something like this, or they're going through something like this, it is going to be a tough decision-making process. And there's various levels, right? To your point, the complexity of dealing with family dynamics and whether this is the best situation for someone or the worst situation for someone. I think at the end of it, you just have to go into eyes wide open to realize like it's going to take a lot of time and effort for you to find what you think is the best solution for your family.
Yep, yep. All right, Curtis, thank you so much for sharing that story about your mom. That is it for today, but please stay tuned for part two of our interview with Curtis, where he will talk about his dad's experience with dementia. Thank you.
Thanks so much.